Hello, welcome back to another social dilemma video. Let's tackle healthcare. This is gonna be a multiple part videos because this area is so big that I can literally spend hours talking about it. But let's tackle one small portion for now, okay? Health insurance. When my son was born 14 years ago, I paid $500 for the insurance plan, Blue Cross Blue Shield, for the three of us. $500 a month. Fast forward 14 years later, as of right now, I'm paying $1,400 a month. No doubt the largest expense of this family. Every month, $1,400. And I'm sure it will go up again in August, as in every August, okay? So, trust me, I feel the pain. Just like most people, we all feel the pain of high cost of insurance. And sure, am I all for universal healthcare, free healthcare for all of us? Who doesn't want that? But here is the problem and why it is so hard to achieve. There are many reasons. But for this video, let's just go with one small area. One of the things that I'm sure all of you have heard that that has been talked about to death for years now. Whenever you hear people talk about universal healthcare or free healthcare for all of us, is they bring up comparison between the US and other countries. France offer that for their citizens. Germany has some kind of plan for everyone. Canada, people love to throw out other countries that have universal healthcare. Japan, people love to justify using those kind of comparison to try to justify if they can have free healthcare or universal healthcare, if they can offer their citizen that, how can we not have that? Right? I'm sure you all have heard that many times from many pundits, experts, YouTube influencers. I have heard this ad nauseum. Now, the problem I have with using those countries to compare is that everyone that use those countries to compare fail to bring up what? They all have much higher tax rate than we have. Okay, much higher. You know that Japan tax rate can go as high as 55%. Yes, I just said that, 55%. Germany, France, 45%. UK, yeah. Nothing is free. It's coming from somewhere. Okay, so don't use the example of those countries to justify your argument unless you bring up many other points to justify why we can do the same thing. I already talked about the problem with taxation in a previous video. Can we fix our tax system here so that wealthier, richer people pay more taxes? Or are we all willing to pay more in taxes to pay for the healthcare? It got to come from somewhere. Nothing is free. Okay? And I'm pretty sure most people will say, I don't want to pay more, just make the rich pay their fair share. How are you going to do that? Have you figured out a way to do away with all the tax loopholes? If you do, I'm all ears. Okay? This is why it's part of the social dilemma. It's easy to talk. Talk is cheap. It's easy to throw out solutions that have zero chance and think that it can be done if, only if, people would unite. It's a big problem, okay? Healthcare is a big problem. Paying for healthcare is a huge problem. Trying to figure out where the money comes from is a bigger problem. And right now, the tax system here is nearly impossible to fix at the current state. I don't know how. I don't have the solution for it, okay? And I don't see how we, the US, can offer universal health care without having more money. Now, another part of the argument that I use in this debate for a long time now is only if we don't waste money in fighting useless war. We spent trillions in the last few years, in the last decade, in unnecessary war. If we only use that money, we could have easily paid for healthcare for everyone. I'm sure you have heard of that, right? Did France and Germany or Japan or other countries that offer universal health care being at war? Spent money on war? They didn't, for the most part, right? So how come they still have to tax so high to pay for their free healthcare? Does anyone want to talk about that? You see how it's, if you dive deep into the issue, all the argument that we can't afford universal health care, only if we stop fighting useless war, only if we let the rich pay their fair share, only if, there's a whole lot of if. That just doesn't work. I love to have cheaper healthcare, no doubt about it, okay? $1,400 a month is a lot of money. But I'm also recognizing that this is a huge problem that I don't see a solution. Regardless of anyone on TV or YouTube that want to throw out all the other reasons why we can't have it, because France and Germany and Japan and Canada can give it to their citizens, but yet we can't do it because we waste money on stupid war. Even if we don't waste money on stupid wars, this country has been running on a deficit for a long time, okay? So it's not as if like we have surplus. On top of that, let me bring back the same argument I used in the last video, the unintended consequence of job displacements. Millions of people are employed in various industries that support war. Millions. Do you have a solution? Does anyone have a solution of switching that workforce to something else quickly? If we decide to stop all war, stop making bombs and rockets, stop employing soldiers, what's going to happen? You know, it's so easy to roll off these nonsense about free this, free that, only if. It's a social dilemma that I don't think I have the answer. Nobody had the answer. At least I'm honest enough to tell you that I think I don't know how or if we can ever solve it. I am all ears. If anyone can bring me or show me a solution on how we can pay for free healthcare that all of us can stomach, as far as we all pay a little bit more taxes, do away with a bunch of loopholes, who knows? Okay, at the end of the day, fixing the tax system is a giant monster. And I don't see how you can not start there. Okay, unless you can start there, there's no way to get free healthcare. Because unless you can fix the tax problem, to do away with all the loopholes, and then if that is not enough, are we all willing to pay a little bit more in tax to cover the cost of universal healthcare for everyone? One other thing that I learned quickly when I was in college, I went to college in Plattsburgh, New York, the upper tip of New York State. Montreal is 1 hour away. And at the time, back in 1985, when I went to college there from 85 to 89, the population is the same today. I look it online. It's like roughly 20,000. And the school is over 4,000, so the rest of the population is pretty small. Yet, when I was a freshman there, I was stunned at how large the malls were, how large the hospital were. I'm like, wow, I wonder why. And it didn't take me long to realize why. Every weekend, the malls and the hospitals are full of cars with Canadian license plate. Yeah, that's what happened when people had to pay higher taxes in Canada or have universal healthcare in Canada, that they can't get good services. They have to wait for months to get some procedure done, and they rather pay in the US to go to the hospital in the US. Okay? It's a trade-off that nobody want to talk about or mention whenever they talk about universal healthcare. Canada has it. Why can't we? Have you talked to sick people in Canada to see if they're happy with the service that they can get? Have you? Okay. If you haven't, find out for yourself to see how good universal healthcare is for Canadians. Okay? There are trade-offs in everything in life. And it's too easy to talk about something and ignoring all the not so good stuff. Okay? So keep that in mind when you hear or discuss universal healthcare with other people. Thank you for watching. Bye-bye.